The outlook, I think, for treatment of patients with myeloma is very good. All the new drugs should now be combined with the new approaches. And that means that allogeneic transplant, CAR T-cell infusions of, and also I think a very important cell is the NK cell, which has efficacy against myeloma cells. And here you can probably do CAR NK cells, which is now done, but we know very little about it. I think that, for example, CAR NK cells can be combined with allogeneic transplants, because the CAR NK cell, the early treatment protocols now have shown a high response rate, but also a relatively high relapse rate very soon. And there is room for consolidation with, for example, an allogeneic transplant.